हेलो एवरीवन, वेलकम टू अनदर एपिसोड ऑफ संडे वेलनेस बाय पॉलिसी बाजार। मैं हूं आपकी होस्ट सिमरन और आज के सेशन में हम बात करने वाले हैं मेंटल हेल्थ के बारे में। क्या आप लोगों को पता है WHO के अकॉर्डिंग 2019 में देवर 970 मिलियन पीपल वर्ल्ड वाइड हु हैड मेंटल डिसऑर्डर्स। अब इतना बड़ा नंबर होने के बावजूद मेंटल हेल्थ के अराउंड ओपनली कॉन्वर्सेशन नहीं होता है। लोग अभी भी शर्माते हैं और घबराते हैं इसके बारे में बात करने से। इसीलिए आज हम अपना प्लेटफॉर्म यूज करेंगे ताकि आप लोग मेंटल हेल्थ के अराउंड और जागरूक हो। और आज हमें ज्वाइन कर रही हैं डॉक्टर मधुरा समुद्रा। शी इज एन MBBS एंड MD इन साइकाइट्री। वेलकम टू द शो डॉक्टर मधुरा।
Thank you so much for having me, Policybazaar. I'm super excited and looking forward to the conversation.
Dr. Madhura, before we start the session today, I just want to take a moment to thank you for joining us today and also for all the good work you're doing through your social media to spread awareness around mental health issues. डॉक्टर, अगर इंडिया में देखा जाए तो मेंटल हेल्थ के बारे में बात करना अभी भी टैबू है। लोग डरते हैं कि लोगों को पता लगेगा तो क्या होगा कि मुझे मेंटल हेल्थ इश्यूज हैं, एंड पीपल डोंट इवन गो टू थेरेपी थिंकिंग कि इसकी हमें तो जरूरत नहीं है, इट्स जस्ट अ फेज, इट विल पास। तो हाउ कैन वी चेंज दैट?
I feel the taboo that you're talking about also stems from a lot of fear because of how mental illnesses are portrayed by the media or news or what we watch in films. To tackle this, I think one of the most important things to do is have open and honest conversations around the truth behind mental illnesses and that it is not in that person's control. Having said that, if you are suffering through a stressful period in your life, be also open about that without any shame, so that you motivate and push others to open up about their struggles as well. What's also important is to educate yourself about the mental illnesses. Read scientific articles, follow experts who give unfiltered but correct information, and try to understand how your body or neurochemical changes that occur in your body lead to these mental illnesses, so that you understand that it is actually a disease and not something that is in one's control.
Doctor, I feel like social media also has a role to play here, especially for teenagers and young adolescents. हम फोन पे रहते हैं, बॉडी इमेज इश्यूज क्रिएट हो जाते हैं टीनेजर्स को, एंड वी ऑफ्टन कंपेयर आवर लाइव्स विद अदर पीपल ऑन सोशल मीडिया. हाउ कैन वी चेंज दैट एंड हाउ कैन वी कॉम्बैट दिस?
Look, there's no denying that we live in a technologically advanced world. While it brings us a lot of ease and comfort, it also has its own side effects. The reason why we are so hooked onto social media or our phones is because of the dopamine hits that we receive with every single notification, likes, or comments. So it is important that we are mindful of the time we spend on social media and sort of reduce engaging in mindless scrolling or even unfollow accounts that do not bring us any kind of fulfillment. Also engage in activities or hobbies that bring you genuine happiness and fulfillment, so that your need to be on social media for that dopamine reduces automatically. Speaking of body image issues, although it is a lot of conditioning that we have also been exposed to right from our childhoods, that a certain type of body or a certain type of face color is the definition of beauty, and what we see otherwise in more commonality is not. So it is important to expose yourself to the right kind of content when it comes to body image. Follow people who promote body positivity, talk about the real issues that they face with their bodies, and start working on your own body image issues and self-esteem with a professional.
Now, डॉक्टर, ऐसा बोला जाता है कि ओवर थिंकिंग इज द किलर ऑफ हैप्पीनेस, एंड आई थिंक हमारे जितने भी यंग वर्किंग प्रोफेशनल्स आज सेशन देख रहे हैं, दे विल बी एबल टू रिलेट विद दिस. कैन यू शेयर सम टिप्स फॉर देम?
When it comes to overthinking, I always ask my clients to understand where these thoughts are coming from. Us as human beings work on survival instincts. Evolution has taught us and our brains to look for the worst case scenarios or any threats in the future that we can predict. So talking to your brain and understanding what it actually is fearing, what is the worst case scenario that it is imagining, and then later on consoling it by saying that I've been preparing for this task for so and so while, and I feel confident that I'm going to make it through. Mindfulness activities like meditation or grounding techniques can also help get get these overthinking thoughts under control. One trick I can definitely tell you is, allot a time for overthinking or worrying thoughts. Give it an appointment so that every day you have set aside at least 10 to 15 minutes and you're allowing your brain to sort of put out there all the worries and all the worst case scenarios that it has been going, brewing through the brain. You can also improve your productivity by setting smaller goals to achieve rather than having the final task, which may sometimes even overwhelm you. Download apps that eliminate distractions and help you follow your schedule, and also indulge in more activities that improve your productivity, such as brain health exercises, prioritizing tasks in the form of urgency, and also understanding that what motivates you to conquer or achieve these tasks.
Now डॉक्टर इंस्टाग्राम पे एंड इन जनरल हम हर जगह सेल्फ केयर पढ़ते रहते हैं, बट लोग इसके लिए अपनी लाइफ में टाइम नहीं निकाल पाते बिकॉज एवरीबडी हैज रियली हेक्टिक स्केड्यूल्स, राइट? तो हाउ कैन दे टेक आउट टाइम फॉर देमसेल्व्स एंड प्रायोरिटाइज देयर मेंटल हेल्थ एंड सेल्फ केयर?
Well, firstly, understand that having a busy schedule does not restrict you from having a good self-care routine. It doesn't have to be something elaborate or something that drains you of your energy, but something basic, just like a skincare routine or a gratitude practice, can definitely set you up for something more. For example, one of the things that I like to do is called as mind mapping. Every morning when I wake up, I just assess my mood levels, energy levels, and irritability just on a scale of 0 to 10. That helps me figure out, what my day is going to look like ahead, and if I should steer away from some of my triggers, what should, I indulge in to prioritize my energy levels based on how I calculated them in the morning. The best part is you can customize your own self-care routine to whatever you deem fit. If you're a nature lover, then finding 10 minutes every day to go for a walk outside, or if you are into books, then finding 10 to 15 minutes every day just before you go to sleep to indulge in a good relaxing book. Journaling practices, having micro meditation sessions with the help of some apps or guided meditation techniques. These are some things that you can definitely do. I feel having a good morning and a winding down routine at night brings you back to the reality, grounds you, and helps you relax and get into that zone for the day. What's important when we speak of self-care is setting the right kind of boundaries and prioritizing your self-care needs. That is, if there's an important meeting coming up during your time of self-care, try to push the meeting by 10 minutes if you have the credibility or the liberty to do so, or prepone your self-care, but do not find excuses to skip this step during your day, because it takes some time for you to actually see the benefits and advantages of this self-care routine, but once you do, you will never be able to go back.
Now doctor, if somebody is struggling with mental health issues, how can their families or friends support them?
Supporting someone in your family who is struggling with their mental health is a delicate balance between providing care and also respecting boundaries. Here are some things that you can do. Listen without judgment. Give them an open ear with empathy and try to understand what their real struggles are. Do not try to give advice directly or jump to conclusions based on what they are saying, but just try to be more understanding and empathetic towards their situation. You can also educate yourself about their condition and what exactly are the difficulties or struggles that they face, and how you can, as a family member, support them better. While getting involved is important, you should also understand that there's a lot of patience that is required. If you push too hard to the person who is in the process of recovery, you might even make things worse. So you need to understand, how long does a recovery take in such situations, and also know that everyone's journey looks a little bit different. What you can do as well is encourage them to sort of seek professional help, but also not try to push too hard. You can create a safe and honest environment at home, and support conversations that they would like to have around their mental health, and also push them a little bit to be more social and get involved in support groups. If your family member is still unwilling to seek professional help, you can talk to a few professionals for crisis interventions. If things go out of hand and if you notice that the situation has progressed worse, you can do some intermediate actions at home by yourself. But while you are acting as a caregiver, you need to understand how to take care of your own mental health. Delegate duties that sometimes can get too overwhelming. Understand what each one of you is good at. If someone is good at communication, then give them the role. If someone is good at socializing, then give them that role. Delegating duties and dividing them will help you take the pressure off of taking care of that person and will protect your mental health as well.
डॉक्टर, अब हमारे व्यूअर्स ने हमारे पास कुछ सवाल भेजे हैं लाइफ के दौरान, सो लेट्स लुक एट देम। तो डॉक्टर, आज का पहला सवाल है ये, आई एम अ थर्ड ईयर बीटेक स्टूडेंट और लेक्चर्स के टाइम पे मुझे बहुत एंजाइटी रहती है, व्हाट शुड आई डू?
I think it's normal to be a little anxious during your lectures or presentations, especially in a demanding field like engineering. But you also need to ask yourself what exactly is making you anxious. Is it a particular professor? Is it a particular subject? Try to be more prepared as you walk into the lecture hall so that the anxiety is automatically controlled a little bit. If there's a specific topic or a lecture coming up, read up about it a little bit in advance so that you don't feel completely out of place. One of the other things that you can do is limit your caffeine intake right before the lectures, because caffeine sometimes can mimic anxiety or increase your heart rate, lead to a lot of sweating, which can make you feel a little bit more anxious than usual. It's also important to have a good support system and a group of friends that can help you alleviate the anxiety, sort of help you on assignments or work that is pending, and also help you push a little bit out of your comfort zone while maintaining boundaries. What you can also do is try to have a good schedule so that you don't feel overwhelmed by all the tasks that are coming at you. Try to find a few moments of self-care within your schedule. Find good relaxation techniques like progressive muscle relaxation, mindfulness techniques. You can also indulge in a little bit of exercise if that is something that your time permits, and you will see the overall difference by a good diet, good exercise, some meditation, if not meditation, easier relaxation exercises, and sharing about your anxiety.
Doctor, the next question is actually around therapy. So the person is asking, I took therapy once, it did not help me much, should I try again?
Look, I get it. Taking the step to seek therapy and then having it not worked out can be very, very disappointing. But you also need to understand that therapy is a process that no one size fits all can approach can be taken. You need to understand what kind of a therapist or what kind of an approach are you actually seeking. Do some research before you get into your next session as to what the therapist specializes in. Can you understand and relate to the problems that they have been treating so far. You also need to, be a little bit more patient, because the first few sessions in therapy can be a little bit more superficial, and therapists sometimes do not take the direct deep dive approach with you. So if you still feel that you can relate to the therapist, if they were kind and empathetic towards, your issues, then you can maybe wait it out for a couple of more sessions. After having waited out although, and if you see no difference, then maybe the specialization of that therapist is what needs to be worked on. The process of therapy in itself can be a little bit overwhelming and heavy. So, see whether you're timing your sessions correctly. If you're taking sessions thrice a week and if you feel like it's too overwhelming for you at present, or, because each session gives us a lot to reflect on, a lot to introspect. So if you feel like you haven't gotten enough time between the two sessions to actually do the work, or spend time with yourself, then maybe space out your sessions. Talk to your therapist. Be honest of what's working and what is not working for you. If you do not convey that this is not working for you, your therapist might not be able to change the approach and understand where you're coming from as well. Lastly, just because of one bad experience, do not eliminate the chance of therapy altogether. Talk to your support system. Try to understand how their experiences were in therapy if they have had before, and read testimonials, feedback about the therapist when you are looking for a newer one, so that you understand how their approach is and if that will suit you as well. If you feel like certain characteristics about the therapist are what you're looking for, maybe someone who is in your age group so that they will be able to understand your problems better, someone from your ethnicity if there are cultural issues that you want to discuss, someone who is trauma specific or is specialized in cognitive behavioral therapy, then do the research and try again. I know it can get a bit difficult and overwhelming, but be patient with yourself and understand that each one deserves the right kind of modality and therapist. So just keep going at it.
Doctor, the next question is around work pressure, which we've just discussed. I have a lot of work pressure and I'm not able to give any time to my wife or kids, which makes me feel guilty. What can I do?
Being overwhelmed with work and finding it difficult to manage your professional and personal life is a very common problem. It's commendable that you're trying to find solutions, but you also need to realize that accepting is the first step towards recovery. So if you want to work on it, maybe try initiating an honest conversation with your partner and your family members about how you're feeling. Prioritize and plan about the non-negotiables like meal preps or weekend outings, movie nights, something that both of you can jointly and mutually agree on and work towards making it happen. Take some time to figure out whether your current job fulfills your long-term goals and is something that you want to continue. But prioritize quality over quantity. That is the quality of time that you're spending with your family members, be it over connecting, over having honest and open conversations, intimacy time are something that you can definitely prioritize. Delegate and learn to say no at your workspace. If the work is too overwhelming or encroaching on your family time, then try to delegate the work and appoint that work to someone who understands your importance and your priorities as well. Whatever you do, do it together. Make your family more involved or your partner have a say in the decisions that you're making. Also indulge in some self-care and prioritize what is important to you and your goals. Lastly, it is also important to understand that small gestures can also be as impactful and important for your family members. You don't have to go out of your way or do something completely elaborate or magnificent, but small gestures of you showing that you care and they are valued are something that you can definitely incorporate in your life.
Doctor, next question is, I struggle with sleeping. Is this insomnia?
While difficulty sleeping is one of the most significant symptoms of insomnia, what you must know is insomnia is a condition that has multiple factors and multiple types. It can be acute or it can be chronic or long term. It can be precipitated by stressful situations. It can be precipitated by some form of medication. So actually evaluating and understanding what form of insomnia do you have. You can do that by visiting a professional or getting a sleep study done. However, one sleepless night does not mean that you might have insomnia or a sleep disorder. After you have evaluated and understood the type of sleeping difficulty you have, whether it is sleep onset or you have difficulty waking up or you keep waking up in the middle of the night, you need to incorporate a good sleeping hygiene to improve your overall sleep pattern. Some things that you can do is, try to keep your electronic devices away at least 20 to 30 minutes before you go to bed. Avoid caffeine and nicotine in the evening time. Make sure that the room that you're sleeping in is, comfortable, not too noisy and not too hot or too cold. It should be a comfortable, surrounding and situation to sleep in. If you are someone who's, has a lot of thoughts while going to sleep, make sure you have a thought diary where you can just jot down your thoughts and reallocate them for the next day. If you keep finding yourself waking up in the middle of the night, try to avoid looking at the, time so that your biological clock does not set itself in that way. You can also, indulge in some remedies, meditation or relaxation exercises to improve your overall sleep quality.
डॉक्टर, आज का लास्ट सवाल हमारे पास ये आया है. I gained weight due to PCOD recently. It's affecting my self-confidence. Please suggest some tips for confidence.
As a PCOS patient myself, I completely understand how difficult it can be to see your body change and not being able to adapt with it. While it took me, some time to get used to and be kind to myself, here are some things that I tried to follow. I did not go into any drastic diets or exercises after understanding that, my syndrome or the PCOS that I was going through was in fact an illness. And it was my habits, it was my lifestyle and the stress that I was going through that led to it. But drastically going into very intense routines would hamper my day-to-day life as well. So I try to take it one step at a time. I try to eliminate some foods or triggers that led me to stress eat. I try to include some form of physical activity on the daily, and as I got attuned to them, increase the intensity or the frequency of those exercises. You also need to educate yourself about PCOS, read articles, understand what exactly your body goes through, and give it the kindness that it deserves. Understand that your body is going through its own drastic and severe changes right now. So putting it under more stress while you are thinking negatively about your body can in fact worsen your symptoms as well. Look at your body beyond the physical appearance and recognize what it actually brings to your table. I started feeling grateful and thanking my body for allowing me to be able to move freely, for allowing me or digesting my food so that I did not feel uncomfortable. So recognizing that it's not just the physical appearance that matters, but also the functioning of your body that is important. I also indulged, in a lot of self-care activities and self-compassion, because remember, what you say is actually what gets ingrained in your brain. So if I noticed myself being too negative or criticizing or harsh towards my body, I objectively corrected those thoughts and I told myself that, no matter what it is going through, it is still showing up for me, and that is important, and that shows strength and resilience. Also, taking the right kind of supplements and not just directly jumping into really, really harsh or severe medications can be helpful as well. Remember, you're not alone in this. Try to seek support and talk to your friends and support system about what you're going through and what you're dealing with, so that they can help you even more through this. Lastly, be very, very mindful of the content that you're following and showing it to your brain as well. I consciously unfollowed accounts that made me feel lesser or insufficient in my own body, and tried to follow accounts that promoted more body positivity and helped me improve my self-esteem. Also understand that if you feel like these negative self-connotations or your self-esteem is taking a major hit, there is no shame in taking professional help.
Dr. Madhura, thank you for joining us today. It was a pleasure speaking with you. And I hope कि हमारे सेशन के थ्रू हमने अपने व्यूअर्स को encourage करा होगा to talk about mental health openly and without hesitation. And to all our viewers, अगर आपको आज का सेशन अच्छा लगा तो please don't forget to like, share and subscribe. We'll be back with another informative session soon. Until that time, अगर आप लोगों के कोई और सवाल हैं around wellness or health, प्लीज आप हमारे कमेंट बॉक्स में अपने सवाल छोड़ दीजिए and we'll take them up next time.